Wherever you are, welcome to this book presentation of the book Governance for Urban Services, edited by Shabbir Cheema of the Ash Center at the Harvard Kennedy School. My name is Jorrit de Jong. I'm the faculty director of the Bloomberg Harvard City Leadership Initiative, and I teach at the Kennedy School. I've been working with Shabbir for, I think, over 15 years, and I've always been inspired by his approach to scholarship of democratic governance. It was about, I think, 12 years ago that his book, The Decentralizing Democratic Governance, came out along with Dennis Rondinelli. And I was very impressed by the breadth and the depth of the knowledge and practical experience that he brings to studying issues that pertain to urban governance, particularly when it comes to an innovative approach to democratic governance. And so I'm just delighted to host this session today where Shabbir will be presenting his new book along with the contributing authors. And we have a number of them here today. We have Harry Blair, Adriana Alberti, Bharat Dahia, we have Nasser Javed, Bo Chin, and we're also expecting Chin Bo and Camila Roca to join us. So you will get a sneak preview to this wonderful book that I highly recommend. We won't be able to cover everything that's in there, of course, but you get a taste of the variety of topics in this book, as well as the overarching theme. And the subtitle is Access, Participation, Accountability, and Transparency. In just a minute, Shabbir Cheema will talk a little bit more about how these themes are interconnected, why they matter to urban governance. And of course, we have to address the big elephant in the room, which is that in this COVID-19 era, the problems in urban areas, particularly in developing countries, have just become bigger. The inequality, the lack of access, the poverty, the lack of sanitation and services was already a problem. But with the additional challenge of the public health emergency, these problems have just become bigger, and a lot of people are in need and are at risk. And for all those reasons, the really important thing is to think about how we can govern these problems, how we can govern the solutions to these problems, and how these principles of democratic governance, innovation, access, participation, accountability, and transparency matter in this time in even more than before. So with that, I just want to introduce the presenter for today, Dr. Shabbir Cheema. He has been for a long time the Director of Democratic Governance Division at the United Nations Development Program in New York, and also has been Director of the Asia Pacific Governance and Democracy Initiative of the East-West Center in Hawaii. As I mentioned, he has written many books about democratic governance, and I think with this one, he has just outdone himself again. And I want to congratulate you, Shabbir, for bringing this excellent group of scholars together, for taking on these really big and complex issues, and for always doing so with a focus on how the scholarship can inform action and practice. And so with that, I want to thank you for all the work that you've done, for being a great friend of the Ash Center and a great colleague. And I'd like to turn over to you for a brief presentation of the book. Shabbir?
Thank you very much, Jorrit. I appreciate kind words as well as introduction to the book that identifies the questions that we dealt with, the question that we raised. Now, to answer these questions, access to services and their outcome and the impact of institutional structures and government policies, we as a team undertook 5 conceptual and global reviews on access, public-private partnership, capacity for innovation, gender equality, as well as participatory budgeting. Then our team members from the countries prepared 9 city case studies in 5 Asian countries along with primary survey based on a structured questionnaire in 20 slums in Asia. And then through Mo Ibrahim Foundation, our team there did a survey of access to services in Africa. I will briefly talk about 5 main conclusions and policy messages that came out of this analysis. The first is that distributing resources equitably to urban local governments and strengthening their planning and management capacity are essential. Rapid urbanization has led to an increasing incidence of urban poverty, shown as reflected in 15 to 45% of the people in Asian and African cities living in slums and squatter settlements. There is an alarming deficit in access to services, particularly in sub-Saharan Africa and in South Asia. Now, in Asia, to cope with these issues, 4 models have emerged at a practical level, or 4 approaches, which is decentralizing political power through constitutional amendment in India. Second is Big Bang decentralization that devolves both resources and political power in Indonesia. Third, in China, the decentralization of fiscal system and incentives for economic growth. And finally, the devolution to provinces through constitutional amendment in Pakistan. So 4 largest countries in Asia coming with 4 very different models. And these studies have analyzed pros and cons. One issue that emerged immediately out of that is that access to urban services and positive citizen opinion of citizens about government programs can take place both in multi-party systems, such as Indonesia, as well as single-party systems, such as China and Vietnam. But when it comes to transparency, it may not be, it is usually not the same. And so that tells you that access is one thing, but participatory mechanisms are another. Now, this issue requires a reform agenda that should continue to focus on devolution of resources and authority to cities, management capacity, especially of city leadership, security of tenure in slums and squatter settlements, and the need for investment in local enterprises. Throughout Asia, in cities, these are the dominant focus areas of reform. The second policy message that has emerged from these studies is that institutional arrangements in cities should be restructured to promote collaborative governance and interagency coordination. Because we see that there is a multiplicity of agencies in the cities, and thus there's a lack of coordination and collaboration due to weak legal and regulatory systems, fragmented mandates of agencies, peri-urbanization with undefined jurisdictions, and vested interest of the elite. The need, which Bharat Daya has very clearly elaborated, is to promote multi-stakeholder partnerships, including public-private partnership with active engagement of civil society. In this also, we have currently priorities of reform dealing with this issue, but that includes the need for coherent national urbanization policies, streamlining institutional roles and responsibilities, both horizontally and vertically, and the need for integrated planning that recognizes the realities of cities so that marginalized people are not deprived of the what I call developed urban spaces. The fourth policy issue that has emerged is that local leadership and transparency mechanisms are conducive to effective service delivery and access. And the instruments for that, of course, are election of local governments, engagement of civil society, right to information legislation, and participatory budgeting, which our colleague Harry Blair has elaborated, as well as other approaches such as city leadership's capacity and the system of public procurement and promotion of ethics. I think on accountability and transparency, one issue that comes very clearly from the studies is that when we talk about access, we have to recognize the challenge faced by marginalized groups, including migrants, women, and minorities. And the examples are China and Vietnam's floating population. Examples are slum dwellers in India, Pakistan, and Indonesia. And so therefore, the need is to come with reforms to cope with these issues. The fourth policy message that emerges from these studies is that information and communication technology can help provide effective solutions to challenges of server delivery and access, because ICT can enhance quality and performance, reduce costs, and improve contacts between citizens and governments. There are a lot of innovations that have been documented in the study. I won't go into that, but just make one point, and that is that the use of technology needs to be accompanied by coherent policies, clarity of institutional processes, and capacity at local level, meaning that technology is a means to an end, not an end in itself. And the fifth and the final policy message that emerges from these studies, that cities have been laboratories of innovations to improve service delivery, but replicating these innovations has been a challenge. The team examined what, why, how, and with what effect of innovations in promoting access to services. Jorrit, Adriana, and all of the city case study writers have elaborated on that. I won't go into detail of that, but we have documented 40 innovations dealing with the cities that we examined to answer the question, what, why, how, and with what effect. And I think there's a lot of very, very useful material on that. When it comes to innovations, I do want to point out that there are challenges to replication of innovations, as the various studies show. It could be opposition of groups with vested interest. It could be lack of political support at the national level. It could be local power structure and elite capture of policies and benefits given by the government. But we should not be discouraged, because I feel strongly, based on this data in these studies, the survey data, that there's a tremendous potential of this innovation to be replicated. But to do that, you require regular documentation, analysis, and dissemination of results of innovations among stakeholders. You need training and capacity development, especially for the city leadership. And you need mobilization of support of champions of innovations. To sum up, I just want to make one point. That is that as cities struggle to cope with the COVID-19 pandemic, it's becoming increasingly clear that those cities with resources and capacity, effective coordination, transparency and accountability, use of ICT, and ability to innovate, these are the cities which are in much better position to respond to these challenges. Therefore, the need is to invest heavily in institutional strengthening and capacity building in cities and towns. Thank you, Jorrit.
Thank you so much, Shabbir. That was a wonderful overview of the big themes of the book. I really appreciated your focus on both diagnosing the challenges in terms of lack of access, inequity, and so forth, as well as the focus on innovations and promising practices that we might study. But then those come with another challenges, like how do you replicate or scale them up? And a number of authors have talked about that in their chapters. So I want to go to our first contributing author, and that's Harry Blair. He has written a chapter called Accountability Through Participatory Budgeting in India, only in Kerala, with a question mark. And so that chapter is both about the success of participatory budgeting in Kerala, as well as the challenges of replication and the relationship between participatory budgeting and accountability. So I wanted to introduce Harry Blair. He works at the South Asian Studies Council, Yale University, New Haven, Connecticut. And without much further ado, I'd like to turn over to Professor Blair. Based on your research, what is the potential of participatory budgeting as an instrument of accountability? Could you talk a little bit about that? Harry?
Thank you, Jorrit. The answer to the question, what is the potential of participatory budgeting as an instrument of accountability? It's very large. It's been quite successful in many ways, but in too many places, it's been very hard to sustain over an extended period of time. Kerala is one of the few places where this has happened. So that has been the focus of my piece in Shabbir's book. Well, participatory budgeting, you've all probably heard of. It began in Brazil in around 1990. Became very successful there, was replicated in actually thousands of places, mostly cities around the world, many countries. In Kerala state began in 1996, which instead of being in one or two cities, it covered the whole state. This was really a big bang introduction. 30 million people live in Kerala, and something like 12,000 local government units. The system works with an annual cycle. Interested groups at the neighborhood level determine budgetary priorities for state investment, send a couple of people up to a higher level. It goes through 4 levels actually. And then this is repeated every year. It has inspired widespread participation, especially among poor population and women. It allocates about 1/3 of the total state capital spending every year. And importantly, it's survived intact through multiple changes in state government between the two main parties. So overall, we could say it has increased participation. It's empowered previously marginalized groups. It has delivered better services for all citizens in Kerala. And there's been some poverty reduction. Now, the important part is, what are the requirements for this? The most important one, which will be familiar to all of you that have worked on decentralization, political will. Strong support, especially at the top level, for a system that is going to take away some power from locally elected officials in local government units. The second requirement, and then this is true of Kerala, political parties, not the typical political party in India, which depends on a specific base, caste groups, classes, farmers, businesses, one underlying base or another. But instead, both the political parties in Kerala have campaigned across the whole electorate. In other words, trying to appeal to all castes, all classes, and the two main parties. And so the result is that when the government changes power from one party to another, the incoming party does not want to disrupt the system in order to benefit its own base, but it is willing to continue that system in place with only minor adjustments. And this has happened through these exchanges of political parties at the top. So these requirements are quite difficult to sustain when participatory budgeting has been tried in other places. Jealousy from locally elected officials that don't want these participatory groups taking away their power have opposed it, and in too many cases have been able to undermine it. And then the other thing is, of course, the parties nurturing their own bases when they get into power instead of programs that benefit all. So participatory budgeting has largely failed elsewhere in Italy, also many places in Brazil where it originated, but it has succeeded in several thousand other places for extended periods. And if that requirement of the political will at the top can be sustained, it has good promise to last in other places as well. And I'll stop there. Thanks.
Thank you so much for that very concise overview of what's really a very complex phenomenon. And just one follow-up question for you. Where participatory budgeting has been successful, it has produced, good outcomes, both in terms of participation and trust in government. Are there any other positive side effects or outcomes associated with a successful participatory budgeting practice? Have you seen in Kerala any other kind of positive effects that came as a result of this participatory budgeting practice working so well?
Well, there has been some significant poverty reduction that I mentioned. One of the problems in Kerala in assessing participatory development is that because of this Big Bang approach, there's no control group. So we can't have any kind of randomized control trials. There's no control there. But it has reduced poverty significantly. There's evidence in Brazil that there's been, where it is possible to do these RCT assessments, there is evidence of reduction in infant mortality in places that have introduced participatory budgeting. So there is some, you could say, some success in improving Human Development Index that the UNDP does every year, some concrete benefits. Although in Kerala, it's hard to tell whether the program itself accomplished these things or the entire state would have improved anyway.
Right, they're kind of factual, but thank you so much for that quick presentation. I want to go to our next author, Camilla Roca. Camilla, are you with us? I see you. I don't see you, I see your name. If you can turn on your video.
Hi, can you hear me and see me?
Yes, I can see you and I can hear you. Welcome.
Amazing.
Camilla works at the Mo Ibrahim Foundation in London and has done an analysis of capacity of city governments in Africa. And I wanted to start, we spoke briefly about COVID-19 and of course, Africa hasn't been hit as hard yet as some other parts of the world, but everybody is bracing for impact, particularly because the local city government infrastructure as well as the public health systems are more vulnerable and less well equipped to deal with the challenges. So my question for you is, based on your analysis of capacity of city governments, how prepared are cities in Africa to cope with the challenges of COVID-19? And maybe you could also talk a little bit about the Ibrahim Foundation's index of governance in Africa and talk a little bit about your work on that and your general approach to assessing city government capacity. Camilla?
Yeah, thank you so much. I'll start with the general response in relation to COVID-19, and then I will move on to a more detailed explanation of the index. But to give you like an initial overview, I'd like to present the foundation. We are an African foundation. We are based in London and Dakar, Senegal. We work on a number of issues that relate to governance and leadership on the African continent. And among our number of projects and initiatives, we do produce what you refer to, the Index of African Governance, the Ibrahim Index of African Governance. This is the most comprehensive data set existing at the moment, including more than 100 indicators that measure what we call governance. In our definition, governance is really the relationship that stands between governments and their citizens, and is defined as what governments do have to provide for their constituencies, and what citizens can and have the right to expect from their governments. Our index includes measures, for instance, that go from safety and rule of law, national security, as well as sustainable economic opportunities, to what extent citizens have access to health, to education, as well as to, for instance, jobs, freedom of expression, of opportunities, and so on. So it's really like a very, I would say, like in-depth analysis of a number of pillars that, yes, are related to governance in Africa, but are also quite encompassing and can apply to any analysis you may want to run concerning Africa. And it's also helpful for universities, for researchers, as well as for like business people, for instance, to understand really like how countries are doing in this whole set of indicators. I'm happy to answer more questions on this, but I'm gonna move on now to the COVID analysis. It's actually really, it's really timely to discuss this, because the foundation has released in April also a more in-depth report on this topic, and now COVID-19 is actually impacting these different layers of governance that I've just presented. So I invite you also to kind of go to our website and read this report. So I'll start by giving you an overview of what is the urban configuration and the urban landscape in Africa. So I'll just start with a very striking statistics. Basically, in 2040, African cities will host around 1 billion people, which is basically the total population of Africa in 2009. Okay, so we do realize that these growing and very pushing urban populations are really creating a hub for cities to be like gradually at the center of governance, and the future of the continent is seemingly going to be placed in the hand of their cities. In 2019, nearly 43% of African population live in urban areas. And we have to consider that when we call urban areas in Africa, could also mean cities that have populations which are bigger than those of countries, for instance. I give you an example: Cairo with 20.5 million inhabitants, Lagos with 13.9 million inhabitants, a population that are largely bigger than many African countries and European countries as well. In our analysis about the impact of COVID-19 in Africa, we realized that packed, unregulated urban areas are considered an aggravating factor for worsening the already difficult situation of public services and public institutions in dealing with the virus. It has been also kind of stated by the research that states with densely packed, fast-growing urban areas and high population mobility as well across borders and across like different urban centers are more vulnerable not only to the contagion of the disease, but also large urban agglomerations also pose a challenge to the whole management and control of the disease, right? Because there is, first of all, very reduced opportunities for social distances. Obviously, now we are trying to make an overall picture of the continent. I know that there are like some countries that are doing better than others in dealing with these situations, varies across like this huge landscape of 54 countries, but take this kind of nuggets and analytical points as really like trying to make a picture that is valid for the continent. Moreover, besides the challenge of social distances, poor hygiene and sanitation in many urban agglomerations make it very difficult to implement regulations such as, the classic washing hands, sanitation practices. And another like very problematic factor is the very limited hospital and healthcare facilities per capita, because obviously when you have like densely populated areas with this growing and often unregulated urban population, is very problematic also for public services to make sure that they are able to cater for the whole constituency. Moving beyond, let's say, the more kind of health-related indicators, we can look at something a bit larger in terms of like the wider impacts of COVID-19. And for instance, if we see that African urban agglomeration are mainly characterized by a massive youth surge, so like huge young population, while economic growth is often taking place without job creation, or at least like a huge amount of what we call informal sector, underemployment and related, we do realize that, it's already very clear from the news, from the literature existing, that the economic impact of COVID in Africa will be huge, probably even bigger than the health one. So we see that really cities are going to struggle with this, because, if you put together the social distancing rule, the sanitation rules, as well as, like closing of businesses, is going to really impact an already existing problematic situation when it comes to providing jobs for this huge youth population in Africa. There will be obviously predictions of inequalities widening, per capita incomes that will lower. And then if you allow me to close with like one final sentence, we also analyze like, again, like another set of satellite issues that relate, for instance, to security. We do not have to forget that Africa is also hosting a huge migration and refugees population that is going to be severely impacted. And this is also like happening in proximities, or at least it will have impact on cities. And again, all these issues are going to really like put to test the capacity of the whole continent and its urban areas.
Well, thank you so much, Camilla. A very insightful overview of the challenges, as well as your approach to assessing capacity. We're going to come back to capacity development when we hear from Adriana Alberti from the United Nations later. But for now, just wanted to thank you for your overview, and the chapter that Camila Roca and Diego Fernandez have written is called Serving Africa's Citizens, Governance and Urban Service Delivery. And as you pointed out, in the time of COVID-19, it's even more important than before to kind of know what the challenges are and what the best points of leverage are as you kind of build in more capacity. I want to move to a different part of the world now and invite Professor Bo Chin from Renmin University, the School of Public Administration and Policy, to come in. I saw you just a while ago, and yes, you're back online. Thanks so much for being here with us. The chapter that Professor Bo Chin has written is called Access of Low-Income Residents to Urban Services for Inclusive Development, the case of Chengdu, China. I'd like to invite you to give a very brief overview. I know that we can't do justice to the full content of the chapter, but if you could give us a sense of what's in the chapter and what your findings are. That will be highly appreciated. Professor Bochin, are you with us? Yes. We can't hear you. Can you unmute yourself, please?
Can you hear me now?
Yes, we can hear you.
Oh, okay, thank you. Thank you for invitation. And yeah, it's my honor to participate in this project. Yeah, we wrote a chapter about Chengdu, and we try to use Chengdu as a case to illustrate how the governments in China, not only central government but also the local government, how they take various measures, various policies tools, try to promote, try to provide better and accessible public service for the floating population or those low income residents in Chengdu. So we use the questionnaire put forward by Shabbir, and we did a little bit study there. And according to our observation, according to our data analysis, we found that actually, as Shabbir just mentioned, the fiscal decentralization was quite important. Because of that decentralization of fiscal resource, so the local governments in Chengdu, they have more and more money, to do things for those low-income people, those floating population there. So that's quite important. And actually, what's even more interesting there is we found that actually, promoting local democracy is also very important there. For instance, for some village, for some urban community there, if you can let the people, participate in the whole process, I mean, the decision-making process there, then people there will have better, mental well-being, they will feel happier. So, it's also good for the low-income people there. So, yeah, basically, I think that's what we have done there.
Thank you so much for the overview. I see that there are a lot of people who are joining us in the attendee mode are also asking questions. I will come back to these questions after we've heard from all the speakers. I see there's questions for a number of different speakers already. So I invite everybody to kind of keep sending the questions. And those on the panel, feel free to, when you see those questions show up, also to chat back. The next speaker is Nasser Javed from Pakistan, and he has written a chapter with Kiran Farhan that's entitled Access to Urban Services for Political and Social Inclusion in Pakistan. I'd like to invite you to give a very brief overview of the chapter. Mr. Nasser Javed is representing the urban unit in Lahore, Punjab, Pakistan. So without further ado, Nasser, please. If you unmute yourself, that will be helpful.
Sorry. Okay. Thank you very much. Good morning and good evening, everyone. The chapter is basically on the provision of urban services, and the way it was structured was basically to carry out case studies of basically two cities. One city was the second largest city in the country, which is Lahore, and the second city we took selected in the north, which was Peshawar. So these are the two cities that we selected, slum areas and the low-income areas, where we carried out this survey on access to services. We had some consultative sessions, stakeholder sessions, and identified the various factors which were hindering or making available the inclusion of these services, especially in the context of the local government system that we initiated in 2001. Probably, may I clarify that when you were introducing in your introductory talk, you mentioned about the constitutional devolution of power to the provinces in Pakistan. That was in 2010 under the 18th Amendment. But prior to that, in 2001, there was a new local government system introduced, and that local government system actually had devolved power at the district level. District is I mean, the country is divided into 110 kind of districts. So this was a sub-provincial unit where the power was devolved. And most of the urban services are primarily based on the municipal level, except for electricity and gas supply, which are done at the federal level. All other municipal services and urban services are supplied at the local level. So this local devolution actually had changed in many ways the supply, the provision of these services. And when we studied these in these two cities, and especially the low-income areas, we did identify some very interesting conclusions on how people viewed on the local participation level and on accountability and transparency manner. And that is actually given in the chapter. I did not repeat all of that. And then we had added some case studies as well as to how this was successful. In short, what we had observed was that because of these devolution of 2001, the access services had actually improved in many of the areas, but not in all areas and not in most of the, and not in many other areas. But as far as accountability and local participation at the local level, that had certainly improved. So this is what actually we, this is what we studied in these two cities case studies.
Thank you so much. And, you know, this is a topic that many of the other authors touched on as well. You know, the challenge of inclusion. You know, as Shabbir pointed out early on, access is not just a matter of providing the service or opening up the benefits. There are other mechanisms at play that prevent people from really benefiting from the services, from the rights that they have. And therefore, we're going to zoom in a little bit on those mechanisms with the next speaker, and that's Professor Debolina Kundu. And if I may invite you, Debolina, to turn on your video. Professor Kundu is from the National Institute of Urban Affairs in New Delhi, India. And we welcome you. Thank you for being here with us today. And we have a question for you. You've spoken about elite capture in your chapter, and the chapter is entitled Political and Social Inclusion and Local Democracy in Indian Cities, Case Studies of Delhi and Bengaluru. And I'd like to invite you to speak specifically on how is elite capture impeding access of marginal groups? And maybe you can give some concrete examples. And also want to acknowledge Thomas Nordberg, who is watching, and he was also asking about how to avoid the influence of vested interests in limiting access to services. So, Professor Kundu, please.
Thank you so much, Professor Jong, and also Professor for inviting me to this important event. Let me start with the 74th Constitutional Amendment Act, which tried to institutionalize decentralized governance in the country. Among many other steps, formation of ward committees on the principle of subsidiarity was one. It tried to bring local governance at the neighborhood or the community level. However, due to the large size of the constituencies, the ward committees did not become functional in most of the cities of India. Instead, resident welfare associations came up in a big way, especially in the last 2 decades in the big cities, and they got localized in the middle income and the elite areas of the cities. Similar tools of interventions are absent in the slums and the squatters and low-income neighborhoods. The resident welfare associations, which we call RWS, they encouraged gated communities where provisioning of basic services got channelized through them. Their involvement has been broadly in areas of operation and maintenance of services, capital investment also in small infrastructural projects, participatory budgeting and planning, as was mentioned by the first speaker, and maintenance of neighborhood parks and security. In fact, efforts have been made to institutionalize them as partners in the development process through the government-led programs. One of the classic examples is the Bhagidari scheme brought out by the Congress government in Delhi, and which was there for quite some time. And under that also we had the My Delhi Eye Care scheme, which tried to bring in funding from the government and help RWAs to take up activities of infrastructure development and neighborhood safety within their respective jurisdictions. In Bangalore, we find RWAs have been very successful in managing water supply, which is where water is always a crisis, and also garbage collection and composting within each RWA area. In times of the current pandemic, we find the RWAs are really working very hard in the elite zones of most of the cities. We are trying to work round the clock in maintaining policing, allowing no one to enter the areas, maintaining social distancing, organizing home delivery of groceries, and also taking care of the elderly within each area. And such organized resident groups are absent in most of the low income neighborhoods. And even if they are there, there is rarely any, they do not have the political connections or their voices to be heard in the government circles, and they cannot garner any sort of funding from the government agencies. And also the absence of tenure stands as one of the impeding factors, which does not allow them to really take up any capital or investment projects, or for that matter, even operation and maintenance. And this has really led to the accentuation of disparity within cities across India. So, and I think one way of really trying to take care of this would be allowing the government to really invest in areas where there are low income pockets and they do not have a voice. So maybe through the community-based organizations or through the non-governmental agencies, something could be done in this regard. Thank you.
Thank you so much for that overview. Very interesting chapter, and thank you for summarizing it and giving us some insight into what we can find. In the interest of time, I just want to bring in our last speakers. We will hear from Bharat Dahiya and from Adriana Alberti and from Martin Drenth. But we're going to start with Bharat Dahiya. He has done research on public-private partnerships to improve urban environmental services. And his chapter was co-written with Bradford Gentry. I'd like to ask you, Bharat, what are the environmental services that you've studied? Can you talk a little bit about, and what was the problem with access, and how have public-private partnerships improved that access? And Bharat is representing the Research Center for Integrated Sustainable Development at the College of Interdisciplinary Studies in Thammasat University, Bangkok, Thailand, of course. And Professor Dahiya, please, the floor is yours.
Thank you, Jorrit. And first of all, Brad and I would like to thank you all for this opportunity. Going to the question, now we all know that the urban poor generally pay twice or thrice for the urban environmental services. And PPPs, public-private partnerships, they do not always clearly focus on improving urban services for the poor. But having said that, they do have the potential to provide improved access to urban environmental services for the urban poor. Now, in order to do so, they have to overcome 6 challenges. And these 6 challenges very briefly are: first is insecure land tenure. Since the municipalities say that if people do not have land tenure, then we cannot provide services. Second is geographical constraints, because these areas where the poor live are difficult to access or geographically challenged. Third is that the households lack down payment for the water or urban environmental services connections. The fourth thing is that there is mutual distrust between poor communities and private operators, because private operators seem to make a profit and where poor cannot pay all that high services cost. The fifth challenge is the conflict between formal and informal systems. Formal are the ones that are provided by the local governments, whereas informal systems operate within low-income neighborhoods, whether they are water standpipes or community toilets or collective waste collection bins. And the last part is that sometimes these systems do not work together very well. Now, I'll give you one example in which case many of these constraints were sorted out, and that was the Manila Water Company Incorporated in the Philippines. Now, in 1997, Metropolitan Water Works and Sewerage Systems Authority, they invited the private sector to work with them. And the eastern part was given to the Manila Water Company Incorporated, MWCI for short. Now they have 98% coverage, and it includes 600 projects targeting low-income communities. And these 600 projects cover more than 1 million people out of the total coverage beneficiaries of 5.3 million in that area. Now, how this was done? The first thing was that in 1998, the private operator created what was called the Water for Urban Poor program. So in which there was a clear focus to provide services to the urban poor. The second was that they decentralized service management and responsibility to the barangay level, which is the village level. And this is the lowest level urban administrative unit. The third thing, what they did was that they created user utility partnerships to enhance accountability and program buy-in so that the users trust the operator and they get connected to the system. Fourth was design and implementation through public consultation to have that sync between the two. And starting 2005, what they decided was to connect the unauthorized slum communities using small piped networks, okay? And for this, they created something called the mother meter, which is for the whole community. And the other thing that they did was that they created a livelihood program where the local communities were engaged, the local community-based cooperatives were engaged to provide services and products which were necessary for the management of water services by the Manila Water Company Incorporated. I'll stop there and then we can pick up some questions. Thank you.
Thank you so much. We're going to go to Adriana Alberti, and she's representing the Division of Public Institutions and Digital Government at the United Nations Department of Economic and Social Affairs, UNDESA in New York City. Welcome, Adriana. You have done a lot of work on capacity development, and we touched on that when we heard from Camila Roca. Can you talk a little bit about what the lessons learned are from capacity development, particularly in low-income countries, in urban areas? And the title of the chapter that Adriana has written is Developing Capacities for Inclusive and Innovative Urban Governance. And that's a great phrase to kind of cover almost everything we've talked about today. So what are your specific lessons in building these capacities?
Thank you. Thank you, Jorrit, and thank you also, Shabbir, very much for your kind invitation to this very interesting book talk. I think the first message is that when we talk about capacity development, we immediately dive into what the governance dimensions are. But the first question that we always need to address is capacities for what? So it is very important to have clearly in mind what are the principles and values that guide action and behaviors, both at the national level and at the local level. And as you know, the 2030 Agenda for Sustainable Development provides a wonderful framework, an action plan for people, planet, and prosperity. And within that, there is a specific goal, which is goal 11, which is dedicated to sustainable cities and communities, and it puts emphasis on safety, inclusiveness, openness. So I think that the first lesson to keep in mind, or lesson learned, is really to start with the core principles and values. And actually, we run what's called the United Nations Public Service Awards program. So we have over 2,000 cases from around the world. And most of the innovations are happening at the local level. And where there is also reference to principles and values, that's where we see that there are more beneficial effects in terms of providing services, especially to the vulnerable groups. So in the 2030 agenda, the issues of integration, innovation, leaving no one behind, and intergenerational equity are critical. And these have been decided upon by 193 member states. So they are also somehow guiding what happens at the local level, at the city level, but both city level and also rural areas. Now, in terms of what are the key lessons learned, the second key lesson learned is that we need to look at the various governance dimensions in a holistic and integrated way. And the 5 key dimensions, of course, there are more, but these are just the most, let's say, important, are number 1, the issue of transformational leadership and changing mindsets. And when we talk about transformational leadership, we often think only about the city level in terms of, you know, the public servants. But actually, if we want to have transformation and a new governance model, it is very important to have programs in place that can also include all the actors. So actors in the private sector, civil society. So transformational leadership as a concept of leadership, not just leaders within government, but across all sectors. And changing mindsets is another very important issue, because the second point is that of institutional change. And as Shabbir mentioned and other colleagues mentioned, one of the key issues is, and I think you have also been talking about this in your books, it's the issue of access and also the issue of multi-dimensional problems. So we need to break the silos. When we talk about poverty, poverty spans across all areas, whether it's health, whether it's education, transportation, housing, sanitation. So again, we need to look at all of these issues in a more holistic and integrated way. However, only changing the formal rules or the institutional arrangements will not have an impact. From the cases that we have looked at, what really helps is having methodologies and approaches in order to ensure that public servants can acquire new skills, but especially that they can internalize the principles and values, for example, of collaboration, of working across sectors. And there are various modalities through which that can be done. But really, changing mindsets is key. And new competencies are needed, because when we talk about integration, innovation, and especially intergenerational equity, public servants need to acquire a completely new set of skills that will lead to different types of behaviors and impact. Those, for example, include forecasting, include empathy, emotional intelligence. So we don't talk enough about these issues, but really, what does it mean that public servants are service-minded and that they reach out to the vulnerable groups? There are a lot of unconscious biases also among public servants in reaching out to certain groups. So those should also be addressed, so that, you know, the public servant really needs to have a comprehensive set of skills that are needed to reach out to those groups. Then the third area is that, of course, of partnership building. And again, there are mechanisms and there are modalities of how do we engage people. And we heard that from others. But again, this requires changing mindsets of public servants, because if they, as our colleague before said, that there is some reticence between the public sector and the private sector, there is distrust. So how do you build that trust? That's extremely important among the sectors to collaborate and focusing on principles and values and what a good society looks like and a new social contract. That is something that can bring together. And we see that now with the COVID-19, that when we put aside differences and we focus on principles and values, that's when people can get together. The other issue is the knowledge data sharing, and especially data. We see data is extremely important, and therefore there are needs for new capacities. Again, public sector is not, does not have the needed capacities to collect data, manage data, open data, clean the data. So there are a lot of things that have to be done. And we see that especially in the least developed countries, more advanced countries, of course, have those capacities. And finally, digital transformation. So the power of ICT, not just as a tool, but really as a critical infrastructure that is needed, and that can help with integration through interoperability. That can help with online courses and other types of learning modalities to change mindsets. So you can see, and that can help through e-participation. So in a way, all of these 5 dimensions need to be looked at in a holistic way, and how they can interrelate with one another and bring about, impact, because that's what we are looking for. So there needs to be a change from public servants looking inwards to public servants looking at the impact and the outcome of their actions and behaviors. And finally, just one more point is, how can we promote this type of innovation and integration? Well, there are various ways, and we already heard that. Of course, there's the peer-to-peer learning among countries, which is extremely important. And we conduct many types of activities, of capacity development activities, where countries themselves come, and also the cities, share through mayors, forums, and other activities. These are critical learning opportunities, because mayors want to learn from other mayors. We may write a wonderful book, but at the end of the day, they're very interested also to have this kind of exchange. Second, it's very important to focus on recognition of public servants. So the awards program, like the ones that you are running, are extremely important. The ones that the UN and cities, there are cities that have awards at the local level, are extremely important, because they can help to codify case studies and also to distill what are the ingredients that are driving innovation. Third is networks. So for example, global networks on innovation like yours, or the UN Public Administration Network, like the one that the UN spearheads on these issues, and also networks at the local level. There are so many networks where cities come together to share experiences. These are incredibly powerful tools. So I just wanted to highlight, and I also wanted to mention benchmarking. For example, the UN e-government survey, which is published by our department, has now included cities. So for the first time in 2018, now we have assessed about 50 cities in terms of digital readiness. And this year we will also come up, with a ranking. And it's interesting because this can also help in providing interesting ideas and inputs to see what the other cities are doing. So these are some of the takeaways, and thank you very much for this wonderful opportunity to participate. Thank you, Jorrit.
Well, thank you so much, Dr. Alberti, and it's a great comprehensive overview of not only what the purpose should be of capacity building, but also what specific things are important to keep in mind as you build capacity, knowing that innovations are hard to implement and require a different type of skill set and mentality. So thank you for that overview. I know we're going over by a few minutes. I do want to bring in Martin Drent before we take 1 or 2 questions. So if everybody is okay with that, I'd like to just go on until 15 minutes over the original end time. Martin, can I bring you in for 2 minutes to give a brief overview of the chapter that you have done with Wilmar Salim on local governance and access to urban services, political and social inclusion in Indonesia. Martin?
Yeah, thank you, Jorrit. So one of the findings of our chapter was since 1999, Indonesia has implemented decentralization, and this has allowed for participation. So at the most local level, communities can now participate in development planning. There they can show their what is needed in their neighborhoods, and then the government will provide funds for that. Our study had a couple of findings that points that led to the good practices. One was leadership. In both cities, the mayors had quite an impact. In Surakarta, the mayor went to see went to the street to find the communities in their where they're working. So they don't need to go to the government, but the government comes to them, like what the previous talk also talked about. One problem in Surakarta was data. Like lots of different agencies, they all have their own data set, and it would be better if the government can combine it all into one data set. In Bandung, the mayor has implemented a lot of digital innovations that lead to more transparency, to accountability, where the people can ask for information on the progress of work units, for instance, or when there's a complaint, they can report that, and then they can track the progress online, and there are records of that, so other people can also see what did other people complain about, and and how did it get handled. There's also the community approach, like also in Bandung, more the mayors. Again, the leadership. What's important, the mayor going to the people and in their own environment. Those were the most important parts.
Great, thank you so much. Again, focus on local leadership in, if people can unmute, a focus on local leadership and implementing new practices. I got two questions that have come in through the chat, and one is directed Harry Blair and one at Bharat Dahia. The first is for you, Professor Blair. It's it's from Natalia Rudiak. What are the paths to electing politicians who support participatory budgeting strategies or activating support of existing elected officials? Why were they supportive in Kerala? Anything you can say about that? I think you have to unmute yourself. We can't hear you.
Okay, yeah, sorry, I dropped out for a few minutes there. My connection collapsed.
Oh.
And so, of course, I blamed it on the Harvard IT system. But then I eventually discovered, no, it wasn't Harvard's fault. It was Yale's fault. Our system had collapsed. So I was able to get a workaround. So I'll let Harvard off the hook here. But on the back to participatory budgeting. What participatory budgeting does really is it sets up a parallel system for these citizen groups to be allocating public resources. And so it's no surprise that the elected officials in local government are very jealous of this and say, hey, what's going on here? We're the elected representatives, so we should be allocating this money. So to overcome that, it takes strong political will at the top, which in the case of Kerala really amounts to an elite pact, you could say, within the leadership of the two main political parties. And so that's what holds the whole thing together. And that's a difficult combination to pull off. That it worked for a while in Brazil, but then the political parties there represent more class interests than a general public interest, which is why it fell apart. And that's why it's so difficult to hold this together. But where it can happen, participatory budgeting can be very successful.
Thank you so much. Last question is for Professor Dahia. The question is from Gutwing Chan, and he's asking, speaking of public-private partnerships, some elected officials and the public are concerned about the increased costs and the potential of losing public control. Are there any governance models that help address that problem?
Well, I think the whole idea in PPP is to bring the great combination between the provision from the local government with proper regulation and bringing down the cost. If we have a good mix of these two, then there is no chance that the service cost will go higher. And as I explained in the case of Manila, if we have the proper conditions in place, the public-private partnership can actually provide improved services. The question is, how do we connect the urban poor to the services? And if we meet those 6 constraints, then we have good solutions to them. So I don't see that this fear is really legitimate. The only problem is that when people or donor agencies just do wholesaling of public-private partnerships without understanding the context. So the good thing will be that the context is understood, the urban fabric, the institutional context, and we figure out whether a PPP is really a good solution or an improved public sector is a good solution. And the last thing is that we have to make sure that when the services are provided, their management and governance is proper so that things are accountable and services are provided properly.
Thank you so much. And that brings us to the end of this book presentation. I want to thank Professor Shabbir Cheema again for the wonderful work that he's done on this book, not just the extraordinary rich content of the book, but also bringing a community of scholars and practitioners together and facilitating the cross-pollination of the work that's happening all around the world. And so I want to give the last Shabbir. Shabbir?
Thank you very much, Jorrit. I want to thank everyone for participation, and I think particularly I would like to thank you, Jorrit, and the team at the iCenter. And I would like also to thank my colleague in my previous home, which is East West Center based in Hawaii, where this program started. And finally, the Swedish International Center for Local Democracy that funded some of these studies. So thank you again, all.
Well, thank you, and thank you to the panel, and thank you to everybody who has been watching or will watch this later on YouTube. We also want to thank Sarah Grukstad, Melissa Danello, and Julianne Crescimano for their wonderful support in making this happen. I hope that you have a wonderful rest of your day. Please be well, stay safe, and see you on the other end, hopefully in person. Thank you. Bye.
Bye.
Bye-bye, everybody.